All right.
All
So
right.
what am I called to?
You are called to a 30-year-old woman that is having difficulty breathing.
Okay. I have my PPE on. My scene looks safe. It looks like I have one patient. My NOI is difficulty breathing. I'm going to consider additional resources. I don't think I need them at this time. And I'm going to consider C-spine. I don't think I need that at this time. Hi, I'm Danielle. I'm with the ambulance. What's the problem today?
I'm having a hard time catching my breath.
Okay. My patient's chief complaint is shortness of breath. My adrenal impression is poor. And she's A on the APU scale because she's talking to me. Her airways open and patent. It does seem like she's having some trouble breathing. So I'm going to check her respiratory rate. So I will count her breaths for 30 seconds and double it. What do I get for your respiratory rate?
You get 30.
Okay. Her respiratory rate is 30. What's your oxygen saturation?
It's at 90%.
90%. Okay. I'm going to give my patient oxygen, 15 liters per minute with a non-rebreather. Is that oxygen helping?
Slightly.
Okay. Moving on to circulation, I'm going to check my patient's pulse. What's the pulse?
It's 125.
Okay. I'm going to check for bleeding. Do I see any bleeding anywhere?
There's no bleeding.
Okay. What's the skin condition like?
Pale, cool, and clammy.
Okay. So at this time, this is a priority patient and she's in shock. So I'm going to cover her with a blanket to keep her warm and transport. Now we're magically in the ambulance. Okay. So you're having trouble breathing. Do you have any other signs or symptoms that are bothering you? Any
My
kind of
chest,
pain or?
my chest feels tight and my throat feels tight.
Okay. Are you allergic to anything?
No.
Do you take any medications?
I have an inhaler.
Oh, you do have that with you?
Oh, I do, yeah.
Okay, we might come back to that. Have you used it for the event? Have you used it recently?
No, I forgot all about it.
Oh, okay, good. Have you had asthma attacks before?
Yeah,
Like
I get them every once in a while.
Okay. Is this one worse than those or about the same or?
It's worse.
Okay. Probably because you haven't used your inhaler. So, do you have any other medical conditions I should know about, like diabetes or hypertension or anything like that?
I don't think so.
Okay. What was the last thing you ate and when was it?
I had avocado toast 20 minutes ago.
Okay. And what were you doing when the trouble breathing started?
I was running up and down my stairs.
Okay. And how long ago was that?
15 minutes ago.
Okay. Is there anything that makes the trouble breathing worse or better?
No.
Okay. Can you describe what it feels like to me when you try to breathe?
Like it's really tight and I can't get a good breath.
Okay. On a scale of 1 to 10, 10 being the most short of breath you've ever been, what would you rate this?
An 8.
Okay. And over the past 20 minutes, has it been getting worse, getting better, staying the same?
It's getting worse.
Okay. I'm going to do a focused assessment. So I'm going to auscultate your lungs. What do I hear when I auscultate your lungs?
You hear wheezing.
Okay. I'm going to expose. Do I see any kind of injuries to your chest or anything like that?
No.
Okay. I'm going to look at your mouth. Do I see any swelling or anything?
No.
Okay. I'm going to palpate on your chest. Do I feel anything abnormal?
Nothing abnormal.
Okay. I'm going to get a full set of vitals. So I will, let's see, I already got a pulse of 125, respiratory rate of 30, oxygen saturation of 90%. What is your blood pressure?
140 over 90.
Okay. And what is your blood glucose level?
It's at 90.
Okay. So I have a full set of vitals. I did my focused assessment. I will now call medical control. So you have that inhaler with you?
Yes.
Okay, I'll look at it and make sure, is it prescribed to you?
It is.
Is it expired?
Nope.
Okay, let's see. And you haven't already used it too much. Okay, I'm gonna call medical control and see if I have permission to use the inhaler. We'll say they give me permission.
Okay.
So use your inhaler, see if that helps. Okay.
It's helping.
Oh, okay, good. The patient's improving. I'll take note of that. And so now I will move on to my repeats, I believe. So we're going to keep transporting in the ambulance. She's doing better, but we still want to get her to the ER. So we'll keep transporting. I'll consider a detailed head to toe exam. I don't think I need it for this patient. I will repeat my focused assessment, repeat my initial assessment, and repeat my vitals every 5 minutes en route to the hospital.